This is the clinical view of a young male presented with a complaint of decreased vision since childhood in both eyes. On the examination, you can appreciate there is an abnormal movement of the eyeball. So what is your provisional diagnosis about this movement, and how will you describe this movement? This is the trans-illumination or the retro-illumination test in this patient. You can appreciate there are some findings in this patient. You can answer the findings in the comment section of this video. This is the retro-illumination test of this patient. Indicating some particular finding related to the particular case or condition. What condition can be associated with this type of trans-illumination defect? You can number those diseases which can be present with the trans-illumination defect on the retro-illumination test. So this is the abnormal movement of the eye associated with trans-illumination defect, and some of the finding in the iris as well. These are the facial features of the same patient. You can appreciate the color of the skin, mustaches, and the iris and hairs. And the abnormal movement of this eyes of this patient. So now what is your provisional diagnosis? These are the extraocular motility of this patient. This is the dextro version. This is the devo version. This is the elevation. This is the dextro elevation. This is the devo elevation. This is the depression, dextro depression. liver depression, and this is the convergence test on this patient, clearly indicating the halting of abnormal movement. So which type of nystagmus it is, and this is a cover test of this patient. You can appreciate the change in the abnormal movement. This is alternate cover and cover test. This is the frontoscopy video of this patient. You can clearly appreciate the changes in the retina of this patient. So considering all these anterior segment, posterior segment and the facial features of this patient, what is your final diagnosis? What is the causes of decreased vision in this patient, and what are the findings that can be easily appreciated from the anterior posterior segment examination and the facial examination of this case? What are the ocular and systemic association of this condition? How will you define nystagmus, and how will you describe when it's present? And what are the types of nystagmus, and which type of nystagmus is present in this case? And how will you manage this case? What counseling will you do in this case?